A patient 45-year-old presents with complaint of scrotal swelling and severe pain for 1 week. Now we start scanning of scrotum. Here we see the right testis and free fluid in the scrotum. The right testis shows heterogeneous texture, hypoequic and hyperequic texture. The normal texture of testes are little coarse and granular. Here we also see minimal fluid around the testes. Now on color Doppler we see increased blood flow. If the testis is normal, then we see minimal flow. Increased flow only occur when there is inflammation in the testes. Now we see the scrotal skin is also thickened. Here we measure the size of scrotal skin. The normal size of scrotal skin is 6 millimeter. When the inflammation occurs, the scrotal skin is also thickened, and here we see the scrotal skin is size is 14.4 millimeter, which is markedly increased due to inflammation. Here we see the epididymis, which shows increased echogenicity and hypoequic. It is occur due to inflammation. The normal texture of epididymis is also like testis or little coarse. Here we see the spermatic cord, which is also increased in echogenicity, and minimal collection also seen. Normally spermatic cord is less echogenic. The size of a spermatic cord is also mildly increased. Here we see epididymis, which is showing heterogeneous texture and increased periphery texture and hypoequic in the middle. Now we scanning the left testis. It also shows heterogeneous texture and also we see fluid in the scrotal sac. Size of testis appears to be normal. Here we also see increased blood flow in the testis, but less as compared to the right testis. Now we see the blood flow is increased in the whole testis. Here we see the central echogenic hilum. The blood flow is also increased in the epididymis. The epididymis also shows heterogeneous texture, an echogenic and little gray texture. Epididymis is also increased in size, and the spermatic cord also shows increased echogenicity. Here we see the spermatic cord, which also shows heterogeneous texture and increased echogenicity. The size of spermatic cord also mildly increased. Now how we will write report. The right testis is normally in size and shows mildly increased echogenicity. No mass lesion seen. On color Doppler, the flow is mildly increased. The epididymis is also increased in size and shows heterogeneous texture. The spermatic cord is also mildly increased in size and shows increased echogenicity. The left testis is normal in size and shows mildly increased echogenicity. No mass lesion seen. On color Doppler, the flow is mildly increased. The epididymis is normal in size and shows heterogeneous texture. The spermatic cord is also increased in size and echogenic. The scrotal skin is also thickened 14 mm. The normal size of skin thickness is 6 mm. The ultrasound diagnosis is bilateral epididymo orchitis with funiculitis and hydrocele. The patient is referred to urologist for treatment.